Hello, everyone. My name is Melissa Hart, and I'm the Program Manager of the Immunization Initiative at the Partnership for Maternal and Child Health for Northern New Jersey. I am also a part of the Power to Protect New Jersey campaign, which is a statewide program coordinated by the partnership and funded by the New Jersey Department of Health. The goal of Power to Protect is to bring statewide awareness to the importance of getting a flu shot. With flu shots now being available to the public, we want to take the time to discuss the importance of receiving a flu shot this year and answer some questions. Today I have with me Dr. Jeffrey Bienstock, a board-certified pediatrician who practices with Pediatric Care Associates in New Jersey. Dr. Bienstock is a fellow of the American Academy of Pediatrics and president of the Northern New Jersey Pediatric Society. He is an active member of the American Academy of Pediatrics, previously serving as the president of the New Jersey State Chapter. Dr. Bienstock is the former director of pediatrics at both Bergen Regional Medical Center and Valley Hospital. He is actively involved with Healing the Children New Jersey, serving as its medical director, and has participated in multiple medical missions around the world. Dr. Bienstock has been named one of the top pediatricians in the metropolitan New York area by New York Magazine and was most recently named New Jersey Pediatrician of the Year. Dr. Bienstock also serves on the Board of Trustees for the Partnership for Maternal and Child Health of Northern New Jersey and is an active member of the New Jersey Influenza Action Group, and he is also our flu shot champion in New Jersey. Thank you, Dr. Bienstock, for joining me today.
Thank you, Melissa, and thank you for that great introduction.
No problem. So we'll go ahead and jump right in. So if you could just tell us what's new for the 2022-2023 flu season and if there's any changes to any of the recommendations.
Well, the recommendations have changed in one factor, and I'll get to that in a second. Back in 2010, we realized that we needed to vaccinate even our youngest children, and we started vaccinating down to 6-month infants. Obviously, those children need 2 shots if they've never received a shot in one flu season. But this year, with COVID and the pandemic that has been hovering over us now for over 2.5 years, the biggest recommendation is to get your flu shot and get your COVID shot if you haven't received it yet. We know that they're safe to be given together, and we'll talk about that in a little bit. This year, the quadrivalent, or 4 different strains of the flu that are connected and incorporated into the annual flu vaccine, is an addition of 1 new A strain and 1 new B strain. And I think that's important to realize that our scientists that are working hard in the labs are staying on top of this to make sure that we are vaccinating for the flu that we expect to see during this coming season, which has already started in Northern New Jersey.
Right. Thank you for that information. So do you know what the experts are expecting for this flu season? There's a lot of speculation that it's going to be a bad flu season. Do you have any insight on that?
Well, I don't know how to define the word bad, but we do know that we will probably see more flu activity this year than we did in 2020 and 2021 into the early part of 2022. And part of the reason is everyone remembered wearing a mask. And while masks help to protect people against COVID, it also helped to protect children, adolescents, adults, and the elderly against all different upper respiratory illnesses. And I think by wearing a barrier, and this is not a hazmat suit, but just a simple mask, we were able to blunt the frequency that we did see influenza, especially over the last year. Everybody remembers back in early March, we had a mandate that masks were not going to be necessary for children in school. It's one of the things that I deal with on a regular basis. Parents ask me, do you think I need to wear a mask? Do you think my child needs to wear a mask? And I say, yeah, I think it's going to help not only stop COVID, but stop strep throat, stop the influenza, and stop other upper respiratory viruses that we will see throughout the year. So this will maybe be one way to think about it. Previously, very few people wore a mask. We had masks on people if they had illnesses like tuberculosis, But for the most part, nobody wore a mask for strep throat or for the influenza. So I think what we will probably see during this coming season is an increase in the number of cases in influenza. This is all tracked by departments of health throughout the state. The CDC follows this. And I think those weekly reports that I look at are already starting to have an incline in the number of cases. We are seeing that already in our office. And it's early, but it's here.
Right. And speaking of masks, so I am hearing a lot of people like opting to skip the flu vaccine and just saying that they'll just wear a mask instead. So will this alone protect them from the flu?
Well, wait, those are the same people that didn't want to wear their masks for COVID, but now they want to wear them for the flu. Not a joke, but again, that would be a great thing. But I don't think one overshadows the other. I think wearing a mask would be great, but I still believe getting the flu vaccine is very important. And remember, the flu vaccine, like the COVID vaccine, doesn't mean that you're not going to get the flu. But we're hoping is you won't be seriously ill. And we know that from prior years where even people that were vaccinated on time, children in their first year of receiving 2 vaccines, as I mentioned before, would still contract the influenza and maybe even still contract the strains that we were protecting against. But those children, those adolescents, those adults like you and, well, seniors like me, were not ending up in the hospital, not ending up in ICUs or having complications. But people do die from the flu.
Yeah, I think it's important for us to remember that as well.
Very important.
Yes. So earlier you touched upon the safety of getting both the COVID-19 and flu vaccine on the same day. Can you just talk a little bit about like what the side effects one should expect from receiving them at the same time?
Well, since this has been a new concept over the last several years, obviously with the COVID vaccine coming out in December of 2020, we know that people that get the 2 vaccines together will have a little bit of an increase in potential side effects. This has been studied by the CDC already, and the CDC shows that there's a slight increase. People that were getting the COVID vaccine, about 8% of them would have muscle aches, headache, a little bit of fatigue. And with the combination of the flu, that number came up to about 11%. The important thing to remember is those side effects are not anything to be afraid of. These are not bad side effects. We know they're very common with almost all vaccines that we give. And once these side effects or these adverse effects or a little bit of muscle ache is through, and it usually is done in your body within about 24 to 36 hours, at the end of that, you're protected against both COVID as a booster for those that hadn't received it and for the flu coming into the next season, which, as I said, is already upon us.
Right. So when you speak of the COVID-19 vaccine and being able to get it as the flu, same time as the flu vaccine, so this is the same for the primary COVID-19 dose and as well as the updated bivalent booster?
Yeah, so what we know now is people that wanted to be vaccinated for COVID, at least with the initial series of 2 shots, even before boosters, have had enough of an opportunity. The only people that I'm seeing now that are getting their initial vaccines are the young children that are turning 6 months of age. As we remember, the age was lowered down to 6 months several months ago, and now we have a group of 6-month-old to 4-year-old children. So I think it's important to remember that, yes, you can get them together. Yes, it's important to get them together. And yes, it can be the bivalent booster that I received 2 weeks ago. I would have gotten my flu shot at that point, but now because I am a senior, I need to get the new and improved vaccine for people over 65.
Can you tell us a little bit more about the new and improved vaccine for people over 65 that you just mentioned?
Yeah, so I guess about 3 years ago, there was a recommendation for a high dose quadrivalent flu vaccine
Okay.
for individuals over age 65. We know that at the two ends of the extremes, the young children under 6 months old that cannot be vaccinated, and for people over 65, they're much more prone to having bad reactions when they receive flu vaccine a little bit, but contracting the influenza is much, much worse for them. So we need to protect those little children, making sure everybody around them are protected. And for the adults over 65, those seniors, we want to make sure that they receive this, what I call a new and improved vaccine, almost supercharged, the way a car might be going down the street.
Got it. Thank you, Dr. Bienstock, for explaining that to us. So I just want to know, like, as a physician, how do you recommend the flu vaccine to your patients and their families?
Well, fortunately, with certain programs through the CDC, on the television, through the partnership, this is already out in the community. So this is not a new concept that I have to, quote, sell to my families. Many of them are already well aware that here it is, August, September, October, it's time for children to get their flu vaccine. However, we incorporate it into the scheme that we use when we have children getting vaccinated. And we know that as soon as we get the vaccine in our office, which this year fortunately was a little bit earlier than it had been in the previous years, we started to inoculate these children and vaccinate them as the vaccine was rolling into our office. However, some parents are a little bit skeptic about receiving another vaccine. However, we know the P in pediatrics is prevention, and prevention means vaccinate. And if you can vaccinate children against these terrible illnesses that do cause harm, children do end up in the hospital with the flu, and there are children that will unfortunately pass away from a preventable disease, something as simple as what we might call a cold, which is the influenza. We need to protect them, and we need to protect them in a timely fashion. As I mentioned, children over 6 months of age until their 9th birthday in their first season need to have 2 flu vaccines given 4 weeks apart. It primes the body. Going forward every year, they only need 1 flu vaccine each year. So very important. And again, we've done lots of things in our office. Personally, we have flyers up. We're talking about the flu vaccine even before we received it in August, letting them know that come the fall, we would like their children to be vaccinated. We know that children under the age of 5 or under the age of 59 months in the state of New Jersey that are in daycare, in childcare, it's mandatory for them to be vaccinated unless they have an exemption. And we have done lots of things besides posters.
Okay.
We ran a flu carnival for several years on a Saturday or a Sunday. Unfortunately, this year, we've been unable to do it because of the pandemic. We cannot have parents and children commingling with each other that might have other things going on. We're hoping that we will be able to go back to our flu carnival come September of 2023.
Thank you for that information. I just wanted to know if there was anything else you wanted to add.
I always have things to add. And I think vaccinating these children and vaccinating teenagers against potentially life-threatening illnesses. You know, while I may get my vaccine and I do get it on time, we know it's important that I'm protected because I do have grandchildren that are too young to be vaccinated at this point. And you never know about the patients in the office. And yes, I do wear a mask. I do wear some kind of cover up, a shield when I'm taking care of a child that has anything potentially spreadable, like an upper respiratory illness. The important thing is to get people vaccinated and get them vaccinated on time. And this is the time of year that we need to do that. There have been enough studies that show there's a little bit of waning immunity in adults, but not in children. Children should be vaccinated as soon as they can. And as I mentioned, that can start in August. But the recommendation for adults is to wait a little bit later. And once October comes around is when I usually get my vaccine and when I usually preach to the choir and help my families understand why it's so important to get one extra vaccine yearly to protect them and their loved ones against the influenza.
Wow. Thank you, Dr. Bienstock, so much for joining me today and giving out this important information to everyone. I really appreciate you taking out the time to speak with me today.
Thank you, Melissa, and thank the partnership for everything that they do each and every day, making an impact on families throughout the state of New Jersey is something that I understand and very, very, very important for our constituents to understand as well. So thank you.
Thank you.